Today we are going to do our Unit 13, intermittent infusion and continuous, and piggyback with IV medication administration. We're going over medications again, so a lot of it's going to start to seem familiar. We're going to do our MAR check times 3 with all our medications today. So today we'll have an IV push, we're going to have a continuous IV infusion, and we're going to have a piggyback IV antibiotic. Teach you how to do all those. Calculate the appropriate dose, we'll do that. Skill overriders, introducing ourselves to our patient, telling them what we're going to do for the day. We're going to get our 2 identifiers, that is, both are come through, make sure we're doing those pre-administration assessments. We want those allergies, labs, physical assessment, vital signs. Swallowing doesn't really matter on this one. Again, we're still following the 6 rights of medication administration. We want to make sure that we're still educating our patient on what drugs that they're being given, what those drugs are for, and what side effects they could expect from this drug. And then we would document accordingly. Well, the first thing that we're going to do is start off with our IV Lasix. You'll have a vial here. I've already done my 3 checks. I'm going to clean the top off with alcohol. I'm going to select the needle. Needle size really doesn't matter on this one because you're not injecting it into the patient. I have an order here that will say that I'm going to give 20 milligrams of Lasix. I will draw that up. I want to be sure to get rid of all my air bubbles out of this medication. We want to not push air into the veins here. I will look that up. I've got my 2 milliliters, which it's 10 milligrams per ml. I've got my 20 here. I'm going to select my appropriate site. Next week you will only have a 1 port to insert your medication into. If it's a saline lock, which means it's just an IV there, we're going to flush that line to ensure patency. It says flush the same rate as medication delivery. I want to verbalize the rate that the IV medication can be given based on syringe selection and medication requirements. Identifies increments on syringe to how many seconds in time. One thing with this IV Lasix, say we're going to give 20 milligrams over 1 minute here. I have 2 milliliters, which is 10 little lines, 10 little increments on the syringe. And if I'm going to give that over a minute, I would want to push 1 line every 6 seconds as I'm giving that medication. Here are going to be a few little sections where you're going to start to verbalize some things. If I have fluids running, I want to know, is the fluids running compatible with the medication that I'm going to give? If it's saline, yes, but if it's an antibiotic, there's a possibility it wouldn't be compatible with this. Verbalizes what to do if IV fluid is not compatible. If it wasn't compatible, I could disconnect the IV that was running, I would flush it, I would give my medication, flush again, and then I could reconnect my IV. If fluid's running, so if fluids are running, opens IV tubing when not pushing the medication. What this means is I would hook it up to the port. As I'm pushing the medication, I would clamp it if above where my syringe is, and then if I didn't, I can actually move the tubing up to there. So just to show a little demonstration here, we will. If I was giving it with fluids that were running, I would pick this port because it's closest to the patient. Whenever I'm pushing the medication, I want to clamp this tubing down. I can do it just by pinching it together as I'm pushing the medication. When I'm not pushing the medication, I would release and let the fluids continue to run. And we would do this. I would push, wait 6 seconds, and then push again, wait 6 seconds until my medication is done. And if no fluids were running at all, I would administer medication at appropriate rate. As we talked about, 20 milligrams would go in over 1 minute. Then we would evaluate patient's response, verbalizes when to expect response and what responses should be expected. With something like Lasix, again, anything given IV is going to happen pretty rapidly, and with Lasix we'd expect the patient to pee, but if it was a pain medication, we'd expect some pain relief. Now we'll move on to our primary and secondary IV fluids. Again, we've already checked our orders, we've done our 3 checks. I want to maintain aseptic technique when opening the packages for both tubings. We're going to label those tubing appropriately, reflecting date for next change set. And then we're going to close the roller. So I have my primary tubing here. I'm going to clamp. I'm actually going to pull it up higher. I will clamp my tubing. Will at the bottom means it's clamped. I will get my bag of fluids here. I'm going to spike this bag. I do it when it's upside down. And now I can hang it on my pump over here. And now I want to prime my tubing, which I'm going to squeeze this drip chamber a couple times, about halfway full or so, and then I'm going to let it drip through here and get all the air out of the line. I've got my tubing primed up here. I'm trying to remember how it wants you to attach tubing fixture. So you can attach it now. I'll clean off my port here. I'm going to attach this on by connecting to the port down here. I want to take and put this blue key. It only fits in here one way. And I push this down in. It's going to open this up. And I'm going to put this in here, put it in between here. I'm going to close this. Now I can unclamp this. Now this is just going to be for a basic infusion. I'm going to push OK on critical care here. It doesn't really matter right now. I'm going to type in the letter B and the letter A. Oh, I pushed the wrong button. Turn it off. Okay. Type the letter B and then A. And then I'm going to push OK here. And I'm going to do my primary bag. It goes in milliliters per hour. That's what I want. We'll say that my order said 150 an hour. Push OK. Every time that I type a number in, I have to push OK. If I don't, and it'll just leave it. VTBI stands for volume to be infused. That means if I have this bag here and say that the doctor only ordered 500, I could type in the 500 here. Once it hits that 500, the IV pump will stop. But for usually bags like this, I'll type in 950 so it doesn't run air in the line. Then here at the bottom, it's going to say volume given. That is not something that you have to worry about. It calculates itself as time goes on. And at this point, I would just click run. Now here it's going to say, are all clamps open? Question mark. They are open. Is tubing not kinked? No. And are drips fluting in the tube? And they are, so I can click yes. So now we'll move on to our secondary. I get my tubing open. It's going to be ampicillin. Now, when you go to look at your orders here, it may you may start looking for how fast this is infused or how long it's going to infuse. And you luckily don't have to worry about that because that is something that these pumps are calculated to do. They have everything in here ready to go for that. We will do this one a little bit differently. I'm going to get the port above the IV pump. I've cleaned it off, and I'm going to connect this to it. And when I do, I'm going to hang this lower, and that's how we'll prime our secondary bag. Now I'm going to stop my pump here. I'm going to hang this bag lower than my secondary. And this will start working by gravity. Now I've stopped my pump. I want to go to review program. I want to push the button that says Program Secondary, and now I can type in the name of my drug here. So I'm going to type in the letter A, the letter M. It'll pop up. I've got one for ampicillin here. Click here. I've got 2 grams and 100 mLs. That's my top option here. I'll click down and click OK. Is this the correct drug? It's double checking us again. It is. So click yes. Is it my secondary bag? Yes. Now, it already has a rate, 200 milliliters an hour, because the pharmacy's already programmed this in there. Click OK. Secondary bag should be equal to secondary volume. Obviously 100, it is 100. And then volume given, that's still from the other pump. Now I can click, here it says call back at end of secondary infusion. This is kind of the option of if you had another antibiotic that you were going to give after this, it would beep and let us know that the second antibiotic is time to be hung up. I don't care about that, so I'm going to click no. And now whenever this finishes, it'll run straight from the primary bag. Then we'll look to make sure our drips are falling into our secondary chamber. A little slower, but I can see it moving, so that means yes. And that would be it for my bag here, my antibiotic here. So then it says verbalizes compatibility between secondary and primary fluids. You want to verbalize making sure that these two are compatible. Evaluates patient response. And then at the end, we want to make sure that you want to verbalize the signs of fluid overload. And then you would be done.